I can call this meeting to order. Board of Health, ladies and gentlemen, the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Shall we wait 1 minute for BCAT?
BCAT is not responsible for the improper use of microphones.
Yes, they are.
All set.
Good morning, good afternoon, everybody. Good evening, everybody. First act is approval of minutes, and we will have to again postpone the minutes for July the 23rd because the three members who were there are not present this evening. So we'll do the August the 27th.
Mr. Chairman, I'll make a motion to approve the minutes of August 27th.
We have a motion
I have a second.
and a second. If there are no other comments, all in favor?
Aye.
3-0. Thank you. And we will hold the ones for 7:23. Citizens' time. Is there anybody who is not on the agenda who would like to speak to this board? I thought we may have one tonight. No. Chairman's report. Well, a couple things. First, hopefully I won't forget. I'll forget later on, so I'll do it now. To our Hindu friends, happy Diwali. Let this Diwali burn all your bad times and enter you in good times, and that's the famous expression. And I also want to wish our Jewish friends and family Happy New Year, Lashana Tova Tika Tevu. Happy New Year, may you be inscribed in the Book of Life for another new year. We can go on to subcommittees, which there are any this evening. Application for definitive subdivision 108 Muller Road. We have a letter to continue, and we will continue that until, I think the date is after the last meeting in October, and if nothing comes about that at that time, we'll have to discuss it anyway. But at this point in time, we will just continue it. Application for subdivision 17 Sears Street.
Good evening, Mr. Chairman.
Good evening, Mr. Murphy.
Thomas Murphy, representing the applicant. This is a subdivision that's pending before the planning board, and I'm here to get your input. It's currently an existing single-family home on Sears Street. Received a variance to split the lot into two. The existing home will remain, and a new house will be built on the newly minted vacant lot to the right of the existing house. But because it's only 86 feet of frontage and not 100 feet of frontage, we can't do an A&R plan with the planning board. We have to do it as a subdivision, so that gets you guys involved. Happy to answer any questions on the project. I've seen the proposed conditions, which my client is fine with. But I'm happy to answer any questions the board might have.
It's pretty straightforward.
Very straightforward. It'll be a
straightforward.
single-family house. It's a very level lot. It's on an approved public way. There's really not a lot of
I
anything unusual.
just had one question for the environmental engineer. I'm looking at is there a drop-off from 214 to 195, a real steep drop-off in the front of Lot 2?
I drove by there today and there is not a steep drop off.
So what is the 195.16 plan? Do you see that in the front? I wasn't sure what that meant.
Well, it's not coming up.
Do you need my,
No, actually, I can look at my hard copy.
you can pass this along, sir. I just had that one question, is what that meant, plan.
I have it.
It's circled on mine.
You're down the front right.
Just didn't know what that word plan meant.
That's on the side yard.
Yes.
Oh, I see what you're saying.
I think that's just the length of the side yard boundary from the street to the back corner of the lot.
Right.
Yep.
Okay, so it's not a big drop-off?
No.
I have no
It's not a
problem.
contour, it's not a contour, it's a
Not
length.
an elevation, it's
Yeah.
just
If there are no other questions, I'll entertain a motion.
Mr. Chair, I'll make a motion to approve the application of a definitive subdivision for 17 Sear Street.
Second.
I have a motion, a second, is there any other discussion? If not, all in favor?
Aye.
Aye. 3-0. Thank you, Mr. Murphy.
Thanks for coming in. Have a good night.
School committee tonight?
Enjoy.
Permits, 213 Fox Hill Road, keeping of animals. And please sign in and your name for the camera.
I am Bill Boyven, and I am resident at 213 Fox Hill Road.
So we have you here for two. Let's talk about the first, the keeping of animals, chickens.
All right, so Mr. Boyden has 5 chickens. I did the inspection on the property. It's away from the lot line. The coop is beautiful, actually. It's big enough, there's a run. Everything was in order, and I don't see why we couldn't issue a permit today.
Did you build that?
No, we bought it. My wife saw this at the flower show one time. It's built in the shape of a hobbit house.
I was gonna,
It's beautiful, yeah.
I was gonna ask you.
Yeah, it's actually hobbit house coops are up in Maine,
Oh, wow.
and they delivered it in one piece. Plunked it in the yard.
So now you're a Tolkien fan.
Oh, absolutely, always was.
Great.
And he has a plan for the removal of the chicken materials.
That was all in there.
So I have a,
How long have you had chickens?
Probably 6 or 7 years now.
Oh, wow.
Yeah, yeah,
I like the picture with the dachshunds on there. That's
of course you do.
so any other questions, or if not, I'll entertain a motion.
Mr. Chairman, I'll make a motion to approve the permit for 213 Fox Hill, keeping of animal for chickens. It's 5 chickens, correct?
Yes, 5.
Second.
A motion, a second, all in favor?
Aye.
3-0. Stay right you are. Where you are. We have 213 Fox Hill Road, keeping of animals permit, I'm sorry, a kennel license recommendation. And would you please, Samantha?
So I also conducted a kennel inspection on the same day, and at the puppies, who are adorable. And he's got 2 medium-sized dogs who are older. Everything was in compliance, the house was clean, you know, they had food, water, everything was perfect, so I don't see why we couldn't give a favorable recommendation.
The animal control officer,
He's not gotten back to me yet, but he knows about it, so has he come out to
He
see
has
it
not
yet?
contacted me, no.
He's been kind of busy.
with your recommendation, then I'll ask for a motion.
Chairman, I make a motion to provide a favorable recommendation for the issuance of a kennel license for 213 Fox Hill Road.
Second.
I have a motion and a second, all in favor?
Aye.
Thank you very much for coming.
Thank you.
It's a pleasure to meet you.
See you?
Enjoy the chickens and the dogs.
We do. Thank you. Have a good night.
Thank you. Under discussion, update on our influenza vaccine, which is,
So, I wanted to get a good idea of the statistics for flu. So I went through the MIIS electronic files that we have, and we've had that since 2014, so I was able to go back that far. So that's the information that you have in front of you. The reason why I wanted to do that is because something new has come up this year, and it has come to our attention that we're not able to overdraw on a 10-dose vial. So when we purchased the vaccine, for last year, for this year, we based that on being able to get 2 or 3 more doses out of a 10-dose vial. So if we purchase 600 doses, that's potentially an additional 180 doses. So we, since we cannot do that anymore, it was a concern that we were not going to have enough flu vaccine at the flu clinic this year. So I did go through it, and I also went through the cost of it as well. So we have, right now, we have the ability to spend $35,000 out of our revolving account. So as you can see, I went through the vaccine cost. So after going through all that, we have an additional $5,600 approximately that we could spend to get up to that $35,000. So after going through everything, I recommend that we purchase an additional 200 doses at a cost of $2,900. So from 2014 to 2019, on average, we did 380 adults at the flu clinic and 128 children. So as you can see, we have Fluzone 360 doses minus what we're going to administer to the first responders, so 360. If we did an average, what we've done from 2014 to 2019, there wouldn't be enough flu vaccine available at the flu clinic. So that's the reason why we decided to go that way and purchase the additional vaccine. So we purchased the Afluria because the Fluzone they're all sold out, it's not available. And Afluria is, I'm told, is just a different formulation of the flu vaccine. And so the plan would be to use that up first because we can't get reimbursed for that. We would get reimbursed for 20% of our Sanofi purchase. So the Afluria we're going to use up first and then move on to using up the Fluzone. So if anybody has any questions about this, okay.
So Susan and I spoke, and then I kind of looked into things a little bit further as the medical director for the flu clinic. Our flu clinic this year is later than it typically is. National and state agencies are recommending that the flu vaccination be given prior to, by the end of October. So, kind of playing devil's advocate while still trying to support the town. As the director and I discussed last week, this flu clinic is really a disaster drill. It is meant to make sure that our ability to dole out whatever we need to dole out is done in a seamless and efficient way, and this is training for that. That being said, it does offer the benefit to the town by getting the flu vaccine. But my point is that we're doing it so late relatively that my fear is that children and elders will probably already, many more than last year, will already have gotten the vaccine. I'm just concerned about having a bunch more vaccine left over and potentially not utilized for our money. I just raised that as an issue. If we were doing it at the same time last year, we did it last year, which is still in October, that would be different. There are folks getting the flu vaccine now. So,
Yeah, that's a
I'm
good
just,
argument.
I'm just
So
raising
what is the shelf
point.
life of the vaccine? How long?
It doesn't expire till like June.
And how much of it can we send back if necessary?
20% of what we purchased. So for the Fluzone, since we ordered 600, we could send back 120. Now, we haven't received the full
Yeah,
shipment.
how many did
though.
we send back last year? Any?
It wasn't too much.
Say 70 doses.
But
So maybe that might cover the delta.
may cover what?
Any delta, right? If you only send back 60 or 70 last year, and you can send back up to 120 this year, maybe.
But we use much more.
No, I get
Yeah,
it.
we use-
Yeah, I get
I
it.
just, I'm trying to be appreciating the director's concern, also understanding, the concerns about having, well, it was high dose last year. But still, I'm just, November 2nd, I'm thinking,
A lot of people are already gonna have it.
I'm thinking a lot of people are gonna have the flu.
There is a solution.
So we still haven't received all of our shipments. So right now, we have 210 doses of the Fluzone. We have another 240 coming the week of October 18th or 14th.
There is a solution, and that is, and we have plenty of time to do this, is that we have a couple of flu clinics prior to November 2nd. and we inoculate as many people as we can. I don't know if you've had any of those scheduled, but I think you would, as many as you have, I think you should schedule an extra one. So if you schedule 2, I think you should schedule 3, and scheduled 1, I think you should schedule 2. And we could do it either at our office, or we could find another place. But I really think that would be the solution, that we've given a lot of it out ahead of time. And I think that you need to book, whatever you have booked, an extra one.
So one thing, we have scheduled, high-dose clinics right now. So we have one for October 7th, and then October, I think, a couple weeks after that on a Monday. We have put out an advertisement for people to bring in their children to do the pediatric vaccinations. So we haven't gotten it went in the paper this week. We still have a lot of open slots available for people to come in and get their high dose and for the children. I mean, one other option,
What kind of numbers do we see typically of those clinics?
So-
See high turnouts?
So that's all in here. So if you look at it, so say last year, if we look at 2018 to 2019. So for emergency responders last year, we gave out 46. The office, the children's clinics, 41, and the high dose, 121. So that was just at, before the flu clinics. So the numbers aren't really high for before the flu clinic. Most people, it seems, come to the flu clinic. I mean, if we're talking the end of October, so because we're gonna have 210 doses, so maybe 450 doses of the flu zone plus what we have for Floria, so that's 560 doses, say. We could move, if the board wanted to do this, and if we were able to schedule the time frame, if the school was available, move the flu clinic up sooner, like October 19th or 26th on a Saturday. We couldn't do it any before the 19th, because we wouldn't have that additional 240 doses.
But even if you moved it 1 week to the 26th. it
Even the
would be-
26th, if we could look at moving
I
it.
think that'd be significant.
The 26th. And it's not, I was at the police station today to speak to the chief about this, and it's not, our flu clinic is not even on the town calendar yet.
Right, we haven't even begun advertising it
Advertising.
yet. So, I mean, we could,
I think that may be another solution, is to look at it for the,
Because I think your concern was that we weren't gonna get it in time, period, and
Right.
so that's why, but I think, I believe the CDC is speculating, because of what's happening in the other hemisphere, that this could be, a very significant flu season. So they are suggesting that everybody get their vaccine before the end of October.
one thing I just want to make the board aware of, which is something that we may have to deal with if a lot of people show up at our flu clinic, is that we could potentially run out within the 3 hours. So as long as, the board is going to be okay with that, going to be able to, I can keep track of inventory. I think we have our inventory system down really well, so we won't have to have people waiting in line.
So the director and I spoke about this last Thursday, and so my response to this was, if we run out, good. I'm glad we run out of flu vaccine serving the town, but, this is meant to be an emergency disaster drill. So this is how we're serving. And I just don't, I'm just thinking by November, I don't know.
So, two things there, right? I think if we can move up the date easily and not impact, if the school's available and not impact volunteer work, and we can get the disaster training coordinated by them, which sounds like we can, then I think it's awesome, right? We should do that. But the other point is, I'd rather have excess vaccines, for small dollars, really, at the end of the day, is what it is, so.
but by the 26th, you should have it anyway, all of it.
Right.
No, we won't have all of it, no. We'll have 450 doses of the 600 that we ordered.
And when will you get the other 2?
We don't know. We haven't gotten a timeframe
Could
on.
we cancel that order if we don't get it? in?
Yes, so we could potentially have the clinic, we don't get it, and you're all done with flu,
And cancel
we
this
could
order.
cancel it.
Or cancel a portion of it.
Yeah.
So we
cancel
might
the
get it after
If-
November
well,
6th
we-
anyway.
We still do have the Afluria, so we'll
Right.
probably have 180 doses or so of the Afluria, so that's 450 plus 180. So, and then we have some of the doses of the, whatever is gonna be left after to the children's clinic of the state-supplied vaccine. And we will have high dose, so we'll need to do high dose at this October 26th clinic as well. Because, well, that's if we don't give it all out, we'll see. But the high dose was expected to arrive the week of 11/1. So after the flu clinic, we're expected to get 50 doses of the high dose, and then 50 doses of that is unscheduled. So I could cancel the high dose if we're not able to, because that won't come
It
in
won't-
time,
Yeah, right.
you know. But that, I was anticipating if we had it on the 2nd, we'd be able to bring the 50 doses.
So the risk of that is, to reiterate what you're saying, is that we could run out on the 26th of,
Yeah, yeah, I'm not saying that we will, because
Right.
when I looked at the averages,
and we can tell the
it was
citizens they can
380.
come in when the next shipment comes in too, right? They can come into the office.
Yeah,
Yeah.
yeah,
And it's late, so
it's late, we may not. yeah,
we may
'cause it's
not.
late.
I think that Dr. Saltzman's recommendation is very prudent. It's better public health, and we're not sure we're gonna get the other 200 anyway. It may
Anyway.
come November the 10th.
And just another option, just to throw it out there, I suppose, would be to cancel the large-scale flu clinic and do smaller scales. No, okay.
No, I don't want to do that. This is something that we provide for the town, and we should be doing this on a yearly basis. I don't want to break up what we've been doing since 11?
And if we had no turnout, then it'd be a different story, but we still have.
We still get,
Yes,
if we do it in October, I know we're gonna have turnout. If we do it in November, I'm concerned.
So
Enough said.
if we, are you available on the 26th? So just wanted to make sure you're
I am.
available on the 26th. So if we,
Are you saying because I'm valued director?
No, because you're the medical
You
director.
really need me?
I hope he's not actually administering the vaccines.
So according to my calendar, I have nothing planned on
you're not
October
available.
26th.
so the nurse may not be available on the 26th.
I changed my plans, but that's okay, I'll see if I can.
No, so October 26th is fine if you wanted to do that. I just wanted to have a discussion.
No, I think it's a
just
valid
thought- I
discussion,
think
for
that
sure.
the discussion's important.
Makes sense.
And so what we could, I'll let you know, like, we'll work on it this week, trying to make sure we change it. with
Yeah,
the
if the
school.
school's not available or something.
Yeah, and then if we get go ahead for that, then we'll continue to give out the flu vaccine though, up until the day of the large-scale clinic, as much as we can. So we can do emergency responders, we could do town employees, we can give it out as much as possible before the clinic, and may have to just stop the clinic early if we need be.
I think we offer, at least compared to other opportunities for distribution, we offer a pretty seamless and convenient way of getting the flu shot, so.
Okay. Very good, thank you so much. Environmental engineer report. Christine, you had a wonderful last Saturday.
Yep.
Long story. But no, I don't.
So last Saturday was Household Hazardous Waste Day, and I wanted to thank the volunteers and the director and our Board of Health chairman for their assistance at the event. We had 468 cars. It was extremely busy. And we typically have a lull around maybe 10 to 10:30, and we did not have a lull this time. It was very, very busy, but, so thanks again on that. And just an update on mosquito risk for the town of Burlington. In your packet, you had last week's mosquito risk maps. That has not changed. Burlington is still classified as low risk for triple E and low risk for West Nile virus, based on the traps that are routinely sampled in town. If people want daily updates on the risk in town, you can go to mosquitoresults.com and get this map, which will show you exactly what Burlington's risk is, which is, as I said, low for both affect both issues. Again, that's mosquitoresults.com.
I still think it's prudent that regardless of the fact that we are low risk, that people should still be conscientious about being out between dusk and dawn. And if you are out, long sleeves, full pants, or make sure you use products that have DEET in them.
Yep.
But I still would take it until, I believe the recommendation is until the first frost.
Hard
But-
frost.
Yeah, but I would definitely take precautions, just because it's a smart thing to do, even though we're low risk.
Yep, and we also are experiencing seasonally warm temperatures right now, so that helps the mosquitoes stay around a little longer. So the hard frost is when you have 4 hours at 28 degrees Fahrenheit or below, so that is usually sometime between October 6th and October 20th around here, but that's when they go away. But again, also eliminate standing water and check your screens, but the using product with DEET and long sleeves and long pants is,
So I was actually in line at a supermarket, and I heard a conversation going on in front of me where somebody said, "Oh, did you know that we had a case of Triple E in Burlington?"
Oh, jeez.
I know, right? So can we just clarify the fact that we have not had a case this year of Triple E in Burlington?
we have, no, there have been no mammal or human cases in Burlington. There were a positive set of mosquitoes for Triple E and for West Nile virus
Right.
trapped in Burlington, but no transmission
And
to
we've had
mammals.
that in prior years
Sure.
as well.
Yes.
So please, there have been no cases, human or mammal, of Triple E in Burlington. Traps have had mosquitoes positive for Triple E and West Nile virus, but that has happened in the past. We are still low risk. We have not had a case in Burlington.
And the reason why we're typically low risk, especially with regard to Triple E, is because the mosquitoes that bite and transmit Triple E to mammals and humans their favorite location is white cedar swamps and red maple swamps, and we just don't really have any. We have one tiny little red maple swamp in Burlington, and we just don't have the areas where they breed. So we tend to be low risk for, it's a different mosquito that transmits West Nile virus, and they're kind of ubiquitous, but they're just low this year because weather conditions dictate, the seasonal variations and what type of mosquitoes we get.
That being said, we do live in New England, so we could have a hard frost tonight.
Yeah.
Also want to note that we have been on this for many, many, many years, more than 31 years, at least I can vouch for. We have helicopter spraying in the spring. Every catch basin in town is applied with insect,
Larvicide, yeah.
long insecticide, long-acting insecticide. We all know about the truck-mounted spraying. So we have been ready, and we have been doing our thing for many more than 30 years with East and Middlesex Mosquito Control Program. So where other communities are had to gear up, this has been business as usual for us to keep mosquitoes at bay. And thank you to the town meeting for each year appropriating that money. Their money went to good use.
And I believe our director was actually interviewed about Triple E risk. Yes, very nice.
Okay. Any other questions for our?
I just didn't know there was so much information on mosquitoes that Christine knows.
More than I ever wanted to.
Well, that's the buzz. All right.
Oh, that is just Nazi.
Yes.
Mr. Chairman, I'll make a motion to approve the environmental engineer staff report.
Second.
I have a motion and second. If there's no other discussion, all in favor?
Aye.
3-0. Thank you. And the Associate Health Inspector report. Please, Simon.
This is kind of a big report because I haven't been here for quite a long time, I realized, when I sat down and did my report. I've been working on swimming pools, tobacco, tanning, camps, kennels, animals, you name it, it's on there. But the only thing I really wanted to highlight was that I went to a forum today talking about flavored tobacco products, particularly menthol flavored tobacco products. And I'm working on getting that in kind of a form that I can present to you guys in case you're interested.
That'd be great.
Definitely
about
interested.
Yeah, very much so.
that.
Have you been getting a lot of calls about this issue, about vaping, e-cigarettes?
I mean, we have the, the report, we know that they're tracking it, but we are, I don't know if you want to.
As we'll hear later on,
Process, yeah.
it's been a real development
Yeah,
from
I'm
our...
sure we will be
What
getting
is an
calls.
FBI
Yeah, I was gonna ask
investigation?
the same question.
Foodborne illness, so there
Foodborne
was,
illness.
there was an outbreak, and I went out with Marlene just to observe the process and kind of watch what she does.
Was everything okay there?
Yeah, it ended up not being
Gotcha.
strong.
So how long have you been here now?
Manufacturer.
Is it 2 years?
Yes, I think it will be 2 years in
2 years.
Yeah.
October,
Wow.
yeah.
We're very happy to have you.
Yes.
And our other newbie.
I was in favor of you the whole time.
It's not
Thank
true.
Are there
you.
any other questions? Are there any other questions?
Mr. Chair, I make a motion to approve the Associate Health Inspector report.
Second.
I have a motion and a second to approve the Associate Health Inspector's report. All in favor?
Aye.
Aye. 3-0. Okay, the supervisory nurse. Please.
Just a couple things. We do have some pediatric and high-dose clinic schedules. It'll be posted. I think we have a couple PSAs out on that for some dates in October. And we have 2 nurse interns starting tomorrow. They're from Northeastern University, and they're senior nurses, and they're going to be working with me and hopefully helping us. Maybe we can add some other little clinics for the high dose too as well, and some pediatric. So I am going to be providing a presentation on how to give child immunizations, and that'll be on October 2nd and also October 9th from 6 to 9 for our volunteers. And
October 2nd, isn't there another couple things going on that day?
October 2nd?
Maybe that's not, isn't that the program at the Marriott that day? You also have a program on the Matter of Balance program on that day.
The matter,
Also is the second day of Rosh Hashanah, with so Jewish holiday that day, and there's something else on that day. It's a very,
the matter of balance is on Tuesdays. Is,
October 2nd, yeah.
October 2nd's a Wednesday, I believe. Because the 9th is.
I'm going to verify, Mr. Chair.
I just know the date, October 2nd. You may want to just take a look at your calendar. It's
October 2nd is a Wednesday, Mr. Chair.
So,
It's-
matter of balance, are you talking about the matter of balance class at the Board of Health that we're doing is on
Yes.
Tuesdays? It's held on Tuesday mornings
It's Tuesday morning.
at Grandview. And that's until October 29th, so it's every
Okay.
Tuesday morning.
Great.
Tuesday morning.
We'll be doing that.
But the 2nd is on a Wednesday.
Yes, and the 9th is on a Wednesday, so those 2 evenings at 6 at the Board of Health, I'll be doing for our volunteers a presentation on how to do child immunizations. And that's gonna help, hopefully, we'll get some child immunization dispensers on board for the flu clinic,
Good.
whenever you guys decide to.
Can the nurse interns give the, they can?
Do injections.
They
yes.
can do?
And they actually, so if we're gonna change the date for the flu clinic, they will be coming and hopefully helping us, volunteering to do immunizations, and assist us on the drill that day.
That's great.
So I'll just need to know whenever we change the date.
Thank you. Excellent. And how long have you been here? Has it been a year yet?
November 7th.
November 7th.
Wow.
Yeah, Another.
Well, actually, if you wanna count the flu clinic last year,
Yeah.
it's been a year.
And again, we're very happy that you're here.
I was in
Thank
favor of
you.
you the whole time.
Yeah.
Again, not true.
I don't have to say that to our environmental engineer. She is a veteran as our director. But thank
Mis-
you.
Mr. Chair, I make a motion to approve the supervising nurse note,
Second.
report.
Second.
A motion, a second, all in favor? Aye. 3-0. And last, the Director of Public Health, who has some announcements from the state.
Yes, so I'm sure you all have heard by now, the Public Health Council voted today to temporarily ban the sale of all vaping products.
Did not hear that.
Okay, so, tomorrow, we're going to send out a letter to all our retailers to let them know they have to remove, all their products and all the advertisements in their stores.
It's huge.
We will follow up with an inspection to make sure that's done. Anyone who hasn't done it will be receiving a cease and desist order.
So
from
can you
us.
repeat where this mandate's coming from?
So it is coming from the governor has declared a public health emergency and asked the Public Health Council to vote on this temporary ban, which they did today. So the Public Health Council voted today to this temporary 4-month ban due to the lung diseases that have been coming up. On September 11th, DPH asked all laboratories and doctor's office to send them any suspect cases of this lung disease. And they investigated, I think it was like 66 cases, and 5 of them were suspected to be this, or had the signs of being this lung type of disease. And it was in all vaping products, not just marijuana ones, it was also in regular vaping products as well, so.
It's big.
Very interesting. Are there any other questions for our Director of Public Health?
So this is not coming from the public health. We have always been ones to respect our business owners alongside our town members. So please abide by this mandate and respect the work that the Board of Health has to do in investigating to make sure that it's being carried out.
Thank you very much for the update.
And again, it's a 4-month ban. I guess it could
4 months.
continue if they
Yeah,
find.
it may continue.
Right,
Yeah.
it's at least 4 months. Great.
I have no questions.
Mr. Chairman, I'll make, is there any other?
Oh,
Okay,
so
sorry.
something else I wanted to ask about. No, go ahead.
Mr. Chairman, I'll make a motion to approve the Director of Public Health staff report.
Second.
I have a motion and a second. No other discussion or questions? All in favor?
Aye.
3-0. Just one quick, I've given you a older document that came originally from our town council quite a number of years ago, but it still pertains to some possible situations and issues that we may have in the future. It is a memorandum which discusses the subdivision control law being supported by Independence Park versus the town of Barnstable. Please take a look at it when you have an opportunity. It may help us out in the future. It was well-written. I've always kept a copy on my desk. If there's nothing else,
Mr. Chairman, I would just, if I might, I just want to make a reminder for, as we are entering into the fall and entering into cold and flu season, please make sure that hand washing is really one of your top priorities and the priorities of your kids if you can. The alcohol or non-alcohol-based products are good, but a report came out recently that if someone were to say to sneeze in their hand and then use an alcohol-based product, it might not be as preventative for spreading disease as actually washing hands. So I know I talk about it a lot, I know we kind of joke about it, but hand washing is the #1 way that we can prevent illness. So just start thinking about it. Thank you.
thank you very much. Do I have a motion to adjourn?
Motion to
Do I have a
adjourn?
second?
Second.
All in favor? Aye. 3-0.
Be safe out there, folks.
Take care.